Good evening, everyone. Welcome to our Instagram Live from Limi Hospital. So, my name is Dr. Ijoma Isni, a personal physician, and with me today is a renowned consultant family medicine physician by the name of
Dr. Kafate. So it's a pleasure to have you online with me this evening. Welcome.
Yes, a pleasure to have you. Feel free as you talk to drop your comments and your questions, and I'll be more than happy to attend to all of them. So today we are going to be discussing a very important topic, the burden of sickle cell disease in Nigeria. Now, the first thing, what is sickle cell disease? Sickle cell disease broadly is an inherited blood disorder that affect the red blood cells. So the next question is, what exactly is causing sickle cell disease? So will you be able to help us with that?
Okay, sickle cell disease is caused by an abnormality in the hemoglobin. Hemoglobin is a protein that carries the oxygen inside the red cell and transport this oxygen to all body tissues. So an abnormality that occurs in this hemoglobin leads to sickle cell disease. And in the course of time, I would throw more light when questions are coming in, how this happens.
Okay, thank you very much, sir. So when hemoglobin is affected in these red blood cells, the red blood cells, instead of being the normal donut-shaped, flexible red blood cells that can pass through blood vessels, no matter the caliber or the size of the blood vessels, the red blood cell of a sickle cell disease patient is now rigid, fragile, so it finds it difficult to pass through these blood vessels. So what will happen? Either is going to clog the blood vessels, thereby cutting off blood supply to the distal parts of to the other parts of the body, or it can simply break, rupture. So, because of this fragility that the red blood cells have, if the lifespan of the red blood cell for the sickle cell disease patient is reduced. The normal thing we have is said to be a healthy red blood cell should last about 120 days, which I believe is 3 months. But now we see that a sickle cell disease patient has a red blood cell that's lasting about 10 to 20 days. That is far less than the healthy one should last. So this is why they have all forms of crises, and then we are actually talking about this today. So having understood this, the next question is, I am AS. Does that mean I have sickle cell disease?
Okay. Generally, the inheritance of genetic substances or material have a pattern that they follow. So if you're AS, it does not mean that you have sickle cell disease. You're just a carrier of that particular abnormal gene called the S gene. In these hemoglobin abnormalities, in fact, let me just give a light here that hemoglobin has a very significant function. And the main important function is to transport oxygen into the tissue for usage, and then to transport carbon dioxide, which is not useful to the body, back. So this gaseous exchange is the main function of this hemoglobin. And this hemoglobin have two chains, which we call the alpha chain and the beta chain, and they contain some substances we call amino acids. So what happened that somebody who has the S gene, it happens that the one of the amino acids in one of the position is replaced or substituted by another one, and this leads to the abnormality called the S gene. That's how we get the S gene in the abnormal place, and it gives rise to the trait.
Okay, so that means that AS is not sickle cell disease. It
AS
just
is
means
a sickle cell trait.
yes, sickle cell traits. And just like he explained, an abnormal replacement, substitution of an amino acid with another one. In plain terms, there is going to be a difference when you put salt instead of sugar in a soup. The outcome is going to be
The
different.
taste will be different. Yes.
Exactly. So you cannot expect to put the wrong amino acid and get the same healthy hemoglobin that you should get. The next question, sir. So what exactly is the burden of this sickle cell disease you're talking about? How common is sickle cell disease in the world that makes it so important for us to be talking about sickle cell disease today?
Well, my opening statement would be that the burden of sickle cell in the whole world, there's the terminology we use in medicine called epicenter. The epicenter globally of sickle cell disease is in Nigeria.
Okay.
So out of every 50 million living with sickle cell globally, Nigeria has about 4 to 6 million of that capacity of the body, which is about 2 to 3% of that body, the whole world. So that is why we see that the epicenter globally of sickle cell disease is Nigeria. And every year, about 300 newly diagnosed children are born in Nigeria that accounts for, for this disease. They live annually with this sickle cell. That's why we see it is a problem for us and it's of public health importance, and we have to talk about it today.
Thank you very much, sir. So just to add to that, as I was saying, there are about 300,000 newly born babies with sickle cell disease globally. And just Nigeria has about 100,000 to 150,000 of those children. What does this mean? That we are contributing about 33% to 50% of the newborn sickle cell disease patients in the world globally. I mean, this calls for a lot of attention. And to worsen it, I understand that about 50 to 90% of these 100 to 150,000 children that are born yearly, they die before the age of 5. So the burden of sickle cell disease in Nigeria is great. Just like you said, Nigeria is what an epicenter of sickle cell disease. So moving further, now we've talked about the statistical value. Let's now bring the burden, categorize it. What is the financial burden of sickle cell disease? Not just on the patients, but we're also talking about the caregivers of sickle cell disease patients. What is the financial burden?
Well, the burden is not just financial. The burden beside the economic burden, we can have it, can group also educational burden. The burden also put a pressure both on the society and pressure also on the family. It also put a psychosocial trauma on all the affected and infected people around. Family and friends are all involved in the burden. So studies have been done in the University of Nigeria Suka Teaching Hospital. A study was done and it showed the economic burden of about 76,711 naira per person. So you can imagine how that one is for a caregiver of a child with a sickle cell disease or even an adult with sickle cell disease. So there are studies that are available that if I begin to cut them, it will take so much of our time. But suffice to say that it's actually a lot. If can you imagine if I convert this to dollar.
Very true, sir. It's actually a lot. Talking about 76,000 naira being the extra economic burden that the family has to carry just because they have a sickle cell disease patient in the family. And further studies have shown that in a hospital, about 19% of these people had to take loans, and more than half of these people couldn't provide for the basic needs of their families. Why? Because they were paying for the hospital. So the next thing we are going to talk about now is the psychosocial burden of sickle cell disease in Nigeria.
So it's also my humble suggestion that I feel that the Federal Ministry of Health should do something about this matter to include a substantial percentage of our budget to cater for these catastrophic health expenses at family level. It will go a long way to help us, and it will go a long way also to assist the psychosocial burden that comes upon the family. Also, another study, so to court, carried out in OAU, 44% of the sickle cell patients considered this psychosocial burden with difficulty maintaining their cheerfulness, their happiness, their active functioning, and even loss of interest in their daily activities. And it has also been stated in that particular research that 64% of them had stigmatizing names. They were called all manner of names, and then some have neglected, some have been abandoned, some have been become street people and street children, so to say, because of the burden. The family can no longer cater for the needs, medical needs of these children. So in another study, about 84% of sickle cell patients and relatives, they said they feel sorrowful and then feel depressed and so on and so forth.
Thank you very much, sir, for that. So we talk about psychosocial burden is a whole lot on people. We are saying people are depressed already from situations in the country, now burdened with sickle cell disease, and see about 84% of sickle cell disease patients saying that they feel depressed. And we also see about 64% saying that people are calling them derogatory names, stigmatization. And that is why we are here today also to tell us what these people are going through and to help us to stop the stigmatization and instead of stigmatizing, offer a lending a helping hand rather to them. So apart from the psychosocial burden, we will now go to educational burden. Because as we know, they grow up, they're in university, they're in nursery school. How does this actually affect their academics generally?
Okay, in another research, some of the students that were approached who have sickle cell disease, about 13% of them in the undergraduate training, they had to repeat some courses just because of the impact of this disease. So we can now know that actually the burden is a whole lot. It can affect every sphere of the person's life, including the person's education and so on and so forth. Some people have to repeat a semester or carry over courses because of frequent hospital visits or frequent medical condition and illnesses, even within home or in a hostel or even in the hospital.
Thank you very much. Educational burden, it can't be overemphasized. Not treating one crisis or the other frequently, just the educational burden that sickle cell disease patients have to go through. The next questions are sickle cell disease. How do we reach the diagnosis of sickle cell disease? How can I find out if I have sickle cell disease? Uh,
The way to find out is always recommended to be very simple. Usually, we normally want, before somebody even have the disease, we feel that there should be a pre-conception counseling so that we don't even have the disease at all. When the event that somebody have come up with the disease in one way or the other, we'll look at it clinically. What are these features that this person is presenting? Normally, in children above the age of 3 to 6 months, they present with some form of painful crisis. Some come with swelling hands and other features as a result of fever or one disease or the other, triggering the problem and bringing them to the hospital. So in the hospital, where with us, as we assess them clinically and look at the pattern of their presentation, we request for simple blood tests. We do their blood counts. We look at the shape of the blood by doing a peripheral blood film. We do solubility tests. We do hemoglobin electrophoresis tests. And we can also do neonatal diagnosis even at the early age. Even here within the North Central, in Federal Medical Center, KFI, we can do what we call high performance liquid chromatography tests. These are some of the tests we can do when somebody has the disease. Other tests can be done even before the child is born. We can discuss that one subsequently.
Okay, sir. So just like you said, you look at the hemoglobin levels. What are they? In a child, once you see that hemoglobin level is about 6 to 8, you already have that intuition that this child might have sickle cell disease. So what do? You screen for that, just like you said, the solubility test, the electrophoresis, but all these tests have how good or sensitivity rather, and what time you can perform them. So we are just going to go into the whole diagnosis thing now. How? At what age? Now, assuming that I come pregnant, can I get to know if my baby in my womb has sickle cell disease? And at what week do I come and be able to find out that, oh, my baby is likely to have sickle cell disease, so I can brace myself up?
Okay, this is an ethical question. Very, very important ethical question. Because conception diagnosis, as it were, has some ethical attachment. Yes, there are methods and techniques available in our age and time for diagnosis of a child which is still within the womb, which we call fetus, to know whether the child have likely of developing the disease. We have so many techniques. We can take sample from the placenta, which we call coronary venous sampling. We can take fluid, which is the amniotic fluid. We can take blood, even from the unborn child, to test for this. But there are specifications and guide on how to do this. For example, if you want to do a pre or antenatal diagnosis of sickle cell disease, the woman is still carrying the baby. She feels her partner and herself, they are both AS, and they want to determine the status, the sickle cell status of their child within the womb. We can do all of these tests that I've mentioned at, some recommend 10 weeks, some recommend 11 weeks, some recommend 12 weeks. The reason being that for those that are ready to terminate the pregnancy, it is better at that range because the fetus is still a little bit little and their products are not much, and the complication associated with the termination of pregnancy will not be that much. So that's why there's a recommendation between 10 to 12 weeks. One can come for that diagnosis. But with the advent of IVF that we have now, we can even do it earlier than that.
Okay, so you just brought me to the next part of my question. IVF. I've heard about this pre-implantation diagnosis, such that we can come AS, and then we can have a baby that does not have sickle cell disease. How does it happen? Is it in every part of the country that we can now do it? What are the expenses involved? How accurate, how successful are these things actually?
Well, the IVF specialists, when you make up your mind to do an IVF procedure, to have a child, the IVF specialist will guide you because the way they are selecting for sex or gender of the child is the same pattern they will select and do the genetic workup for that particular embryo that they will transfer to the mother. So they will select the normal embryo and transfer, and then the abnormal ones that have the abnormal gene or chromosomes, they will discard it. That's how it is being done.
Thank you very much, sir. So the next thing we are going to discuss now is, now we know about that, how are the ways that we can reduce the burden of sickle cell disease in Nigeria? In medicine, we always talk about the primary, the secondary, the tertiary. Now, for the primary, we talk about creating awareness, which is what Limi Hospital is doing today. We are telling you so you can tell everyone else in their villages, in their cities, in their towns about sickle cell disease. And we've told you how common this is. The trait is 1 in 4 people. So for those of us that are in the dating market, one of the first questions, what is your genotype? Especially if you're AS. So
Leads to creating awareness. Like we used to know, June 19 of every year is called the World Sickle Cell Day. And we also have a day in Nigeria we call the National Sickle Cell Awareness Day, every September thereabout. So these are privileges and opportunities that we go out there and educate the populace about the burden of this disease and how to prevent it. In addition to legislation and pre-conception counseling, it is important that every individual, man or woman, should, before even entering high school, should know his or her genotype. That will go a long way to help us that even while during their studies, the teachers and the lecturers will begin to, from time to time, talk about this here and there, and everybody will have a little more awareness.
thank you very much, sir. So if you are just joining us, this is Instagram Live, on Instagram Live with Limi Hospital. And today we are discussing the burden of sickle cell disease in Nigeria. You've already talked about what sickle cell is, the cause of sickle cell, the diagnosis of sickle cell, and now we are talking about how can we reduce the burden of sickle cell disease in Nigeria. This is the primary prevention, and now we are at the secondary prevention stage, where we talk about antenatal screening. It's very common now in most hospitals. Once you are pregnant and you go to the hospital, first line test they will do, genotype is always there, and from there they will ask you what is your husband's genotype. If you don't know, hospitals offer to test for your husband's genotype, and once we find out, we can now counsel you accordingly. And we've already talked about prenatal diagnosis that can be carried out when you're now pregnant and you want to know what is the genotype of this baby in my womb. Now, the third thing we talk about is tertiary prevention. Okay, I have sickle cell disease now. How can I now manage it? Are there ways to cure it? Are there ways that I can patch myself and make sure I live a long, healthy life?
Okay, the questions that I know some of our online participants will ask is sickle cell curable and stuff like that.
Yes.
I will use this opportunity also to add a note on that. But in our hospital policy, we want to deliver antenatal services to our guests, to our clients. Antenatal screening of sickle cell disease is an automatic component of that package. So all our antenatal users, service users, they have this benefit and privilege to be screened. So we want to tell the public, in case you have any way or any means of becoming pregnant and you don't know where to do antenatal service, you can come over to us. We have a package available to take care of you. And then in the tertiary prevention, of course, in tertiary prevention, somebody already have the disease, the diagnosis have been made, and then the person come with the disease or the disease complication. I've asked a question earlier whether the disease is curable or not. Yes, we have methods by which the disease can be cured. We can do stem cell transplant, which we commonly call BMT, bone marrow transplant. Bone marrow is harvested because the manufacturing or engine room that manufacture red cells in adult is the bone marrow, and these are located in the central skeleton. The central skeleton, I mean, from your head down to your vertebral column, and then the distal part of the long bones, that's the femur, and so on. So this engine room is there producing this red cell, but the disadvantage is that the red cells are bad. Some of them are not good, and they are the one we call either SS or SC or SD, depending on the type. Okay, so this in our modern day we have various methods of achieving a cure. In the US, genetic therapy have started. The studies have started in 2020, and then they are beginning to have a clinical trial of the various genetic processes they are doing to achieve a cure. But for now, we have the stem cell transplant, which is being done even right here in Nigeria, in Ife. And the cost of this, somebody will ask me, how much does this cost to do a stem cell transplant? I will just hazard a guess because at the moment I don't have the fixed price in my hand, but around 15 to 20 million about to do the transplant. Thank you.
Thank you very much, sir. 15 to 20 million, that is just increasing
that is a lot of
burden
financial burden
of
and
sickle
throwing the family into
cell
severe financial crisis. And some people will call it financial quagmire. That's what some people out there will call it.
Okay, sir. So, stem cell transplant. What are the advantages and disadvantages? Advantage, you have a cure, but people are not going for it that often. One, we talk about the costs, but apart from that, you need to find someone who is suitable.
Yes,
to
success
give
rate.
Stem cell transplant.
Success rate.
Yes.
Success rate. Well, the ones we have done in Nigeria so far, because there are indications, it's not everybody that we meet the criteria. Okay. Those that have met the criteria and those that have the financial capacity to pay, as far as I know, almost all of them have achieved success. The ones that were done in Ife.
Okay. Thank you very much for that information. So apart from Ife, I also saw that we can do it in places like Lutz and some other private hospitals in Benin have been able to start stem cell transplants. Amino Kano Hospital.
Okay,
they commissioned the ward, and we hope they will be able to start soon if they haven't already started. Gene therapy, very important also. It hasn't come to Nigeria, but we are hoping that with further success rates and trials that the face of sickle cell disease will be changed in not just the world but in Nigeria also. So we can now take some questions from the comment section and some questions that people have already asked us. So one of the questions that we have is, how long do sickle cell disease patients live? How long do they live? Is a very
All right, all right.
okay. So how long can they live?
Well, people have been deceived in a way that somebody with sickle cell will just live for 10 years or 12 years. Uh, that is a fallacy. The life of a man is in the hand of God. That is the baseline. But somebody with sickle cell have a chance of developing the complications that can easily lead to death. And then, beside the complications that can easily lead to death, to say the person will die at this particular age, nobody has that power to see when this is so. But there's a likelihood or chances that somebody with full-blown SS disease will die early. That's the summary of this statement.
Yes, but when carefully managed, the complications are managed. You take your health seriously as you should. Sickle cell patients live up to 50 years and above. So it's not something that we believe we should be scared of. Now, are individuals with sickle cell disease drug addicts? Now, to answer that question, what I'm going to say is they are prone to taking painkillers, that's pain medications, but it doesn't mean that they are drug addicts. However, they have a likelihood or possibility of becoming a drug addict more than maybe some other parts of the general populace because they are taking drug medications, they can gain tolerance, so they need more and more and more of these drugs in order to feel less pain. So sometimes you can just
Name of their drugs. They know the name of the drugs that help control their pain. They will specifically direct you as their attending physician to give them that particular drug. And if you don't give them, it's a fight. It's a fight. So people who have this disease, yes, they are more likely to be addicted. Some of them will tell you the various names of the drug. Doctor, this pentazocine you're giving me is like water. Give me morphine, give me morphine, give me morphine. They'll be shouting at you. Give me morphine. Some of them go alone. I know somebody that have been injecting himself with morphine, and the person developed kidney disease as a result of this. So some of these drugs, when they get addicted to it, it leads to other complications. That's why the complication of sickle cell, generally, I will just group it into disability, discomfort, and the extreme is death.
Thank you very much, sir. So the last and the other part of the measures to reduce this burden is the self-preventive measures. Now, what can you as a sickle cell disease patient do to prevent having crisis? Talk about taking a lot of water, liver fluid intake, taking your painkillers. Then, because they are prone to infections, we talk about vaccinations. We'll still buttress on the complications and talk about the infections that they are prone to. And we also talk about medications like hydroxyurea, which has been of great help to sickle cell disease patients recently. It reduces the number of crises they have. So, taking such medications can also help sickle cell disease patients. Avoid cold and extreme weather conditions, excessive physical work also. So, this will just generally help to prevent crisis and prolong life to sickle cell disease patients. So, the next thing is complications. What are the complications of sickle cell disease? I would like to start with the first one, what we call vaso-occlusive crisis. If you remember, I talked about the fact that these red blood cells of sickle cell disease patients, they are rigid, they are fragile, they can't pass through blood vessels so easily sometimes. So what happens? They clog the blood vessels, reducing blood supply to those other parts of the body. So when this happens, they can come down with things like leg ulcers, they can have stroke and paralysis. They can also have what is called priapism. Priapism just talks about when someone has an erection but is not coming down and can take like 4 hours and then you need to do procedures and all for the person. We have what is called acute chest syndrome. This one, if you see someone having sometimes, you might think they are having an asthmatic attack or what we call a pulmonary embolism, just blood clots in the lungs. But actually, what's just happening is that that red blood cell has blocked the blood vessel again. They have chest pain, they can't breathe. So you have to start giving hydration, a lot of intravenous fluids, a lot of painkillers, and all of that. We talk of the eye problems they can come down with. Blindness also happens in them.
Yes, they can lose vision.
Yes.
Some of them can lose vision. The reason why they will lose vision is because of what she had already started mentioning. The blood becomes thickened, the blood piles up, and the blood stout up and form what we call a kind of Rolex formation, and they pile up and block the blood vessels that supply the retina, and that's how the person will lose vision. And then one of the complications that is very, very common is anemia. How common is anemia among the patients that present to us in Limi Hospital? In fact, that is the topmost common complications that most of our patients or guests that come into our center present with in the Limi Hospital here in Abuja. And how do they arrive at that? As she was trying to explain earlier, the lifespan of these abnormal red blood cells is shorter. The good or normal red blood cell can stay in the blood vessel and live and do its work for about 120 days, 100 days, thereabout. But for this abnormal cell, they cannot live beyond 21 days, so to say. And so they die quicker. So because they die quicker, the person develops shortage of blood, and that is what we call anemia. So that is the commonest presentation of sickle cell complication in our center, the Limi Hospital Group in Abuja. That has been our experience so far.
Thank you very much, sir. So, as I said, anemia, and sometimes when you see people, they're having their eyes are very yellow. They complain of dizziness often. It is not their chest today; it's their bones. They are pinning them. You start to suspect that this person might actually have sickle cell disease. So you need to have a high level of suspicion also. That's why we are telling you these things as the symptoms of sickle cell disease. So again, if you're just joining us, this is Limi Hospital Instagram Live, and we're discussing the burden of sickle cell disease in Nigeria today. As I said, feel free to drop your comments, your questions, and we're more than happy to attend all of them. So our next question is, what medical problems are caused by sickle cell disease? We've talked about some of them already.
We talk about a lot of them, but just to list them out again, from head to toe, the person can have a stroke, the person can have loss of vision, the person can have bone abnormality, the person can have chest pain, which in a simple way, in our parlance, we call it acute chest syndrome. But normally, for you, we'll say the person can come with chest condition, which is chest problem or chest pain, difficulty in breathing, panting for air, and almost passing out. That's the common way they present for the chest pain. And most commonly, they come with painful conditions. Either hand is painful or legs is painful and swollen. Even among the children, we have seen a lot of that in our Limi Hospital group.
Yes, sir. So why is it called sickle cell? Well, as I said earlier, the abnormal hemoglobin is what carries oxygen. So when there's an abnormal production of this hemoglobin, the sickling, the shape that forms is like that of a sickle. Um, I wish we could actually represent it for you, but the shape is that of a sickle, and that is where they got the name sickle cell disease. Then there's another important question that we need to talk about. Can sickle cell disease patients fly?
Ah, this is a very important question. Sickle, let's throw light for you. That sickle means C-shape, something that look like people that go to farm rice, you will see them have a sickling tool. So if you see the shape of their sickle tool, that is how these abnormal red blood cells look like. They look like a C shape of the sickling tool of a farmer. But the normal shape, as we said before, is like a cycle, is circular, look like a donut with a hole in the center. The donut that you eat, if you can imagine that, that is how the normal shape of the red blood cell is. So it easily meander through the small blood vessels, which we call microcirculation. So it can go anywhere. For people that want to fly, every airline industry have their recommendation. But standard, somebody with severe anemia, somebody with anemia that is less than 8
So,
grams per deciliter of blood, it is recommended that the person should not fly, because the higher you go, the higher the altitude, the deficient the oxygen becomes. So for those that need to fly, they have to carry what we call supplemental oxygen. And that's why when you get on board, the hostess and the other men, the crew members, they announce to you and show you where there are portals of getting extra air whenever you fly. So before you fly, see your physician. And we, in the Limi Hospital Group, we take care of people who fly. We call it fit to fly. We determine your status of fitness before you fly. So if you need that service, you can come over to us. We will render that service for you and determine whether you're fit to fly or not.
yes, I can rest assured that getting a fitness to fly for a nurse is something that wherever you take it, nobody's questioning about it because everybody knows that our tests, everything we do, accurate standard. We already have a name for that. So just like he was saying, there are various rules and guidelines that you have to take once you're sickle cell disease patient flying. These rules might differ airline to airline, but generally if you enter a plane, try not to sit for too long, more than 2 hours. Try to walk about because stagnancy can also worsen and start up a crisis. Take a lot of water. Carry what like you need to take a whole lot of water. Try to tell at least one member of the cabin crew that okay, I have sickle cell disease, just in case something goes wrong. Let them not start thinking, what does this person have? They just act immediately. They can even tell you on other things that you can do. The plane can be cold, so please come with your sweater. Guard yourself very well. So with these things, you should be very safe to fly. The next question is, what is the treatment plan? Or what are some of the treatment options that we have? Well, we already talked about this. We talked about the cure that there is, and we talked about when someone comes in acute crisis, what you can do for the person. Talking about the cure, we talked about stem cell transplants. As we said, the bone marrow is the engine room that's producing these red cells. So what we simply do is we look for somebody whose bone marrow tissue is very compatible with yours, and then we give you a bit of that person's bone marrow to now produce healthy red blood cells for you. We talked about gene therapy also, where we tried, they looked at the gene, they tried to increase the production of a particular type of hemoglobin that helps to carry oxygen in the blood, which is better than the hemoglobin S. The other question now is why is it important for a child with sickle cell disease to be seen by a consultant
Well,
Egyptian
this
hematologist?
is a very important question for our children. In the Limi Hospital Group, just to inform you, we have a special hospital that is dedicated to our children in Nigeria completely. We call it the Limi Children Hospital. And we practice a lot of this care in that Limi. Our pediatric hematologists are available for your services in the event that you have a child who has any form of sickle cell disease. Not only sickle cell, any form of disease that you don't understand. You can bring the child, we'll be able to diagnose the child for you and give you appropriate guide on what to do. For the sickle cell children, it is important that they see pediatrician because they come down with a lot of problems. Even early as 3 months, 6 months old, they can develop the disease. As we said earlier, the lifespan of these abnormal red cells does not stay beyond 21 days. So there's a need for our children because they are the future. They are our future generation, so to say. We need to guide them. We need to protect them. We need to save them from having any untoward discomfort, disability, or whatsoever kind. So that's why we encourage our participants to tell their relatives, family, and friends to come over to pediatric unit of the Limi Hospital Group to be able to diagnose or to be able to manage their children for them.
Thank you very much, sir. So yes, sickle cell disease is what we call a multidisciplinary disease where you have a whole lot of people coming in to help manage sickle cell disease. We've talked about the pediatric hematologist, that's the blood doctor for children. There is one where the neurologist, pediatric neurologist, might have to come in because stroke can be a complication. We talk about the skin doctor has to come in if he has ulcers. We talk about the respiratory doctor also might even have to come in if he's having his acute chest syndrome. So it's something that you need a specialist to attend to the child, and that is what we have at Limi Children Hospital. Specialists attending to children specialized cases.
And some people will be asking, do you have that service? Do you have those specialists? Yes, we have many of them that you can come and be part of the care in the Limi Children Hospital.
Thank you very much, sir. So the other question that we have. Okay.
We have seen a lot of that too in the Limi Children Hospital, even some of our branches. We have seen parents coming in to our hospital, and then one parent will come and say, I am AA. The other parent will say, I am AA. Why is my wife? They keep a kind of suspecting each other. That's why I use the word that this is an ethical question.
Okay. So just to say it again, can someone who has sickle cell have sickle cell disease without both parents being AS? It's an ethical question, and it is not something that's realizable for you to have sickle cell disease if your parents are not both AS. If you have sickle cell disease, that means that your parents have the traits and they were able to give it to you. But if your parents are AA, then we don't see why you should have sickle cell.
Because it is an inheritable disease.
Exactly, it is inheritable. It is genetic. It is what they're giving you that's supposed to come out.
Parents who are having the gene called the S gene transfer it to their offspring.
Okay. So the next question: are there different types of sickle cell disease?
Yes. All along what we have been discussing, there are different types of sickle cell disease. There is a type called the homozygous type. In that homozygous type, the manifestation of the blood that we test will show hemoglobin SS. That is the homozygous type. I want to make a note here that among the type I'm going to mention in this category, this is the commonest and the severest. Then we have the other group called the heterozygous variants. That means you have the S gene and other variants of the abnormal red blood cells. This can be S plus a C-type gene, which we call SC, and then it can also be combination of CC type. It can be combination of S and other form called thalassemias. These are not common in our times, but they are very common in the Mediterranean part of the world.
Thank you very much, sir. So we also have what we call a marriage chart. So it's very important that you also try and look at that. We might bring up that later, where you see AS, who can marry, SS, AA, can you marry? So SS and AA, of course, can marry. They will have mostly AS. AS and AS, we advise, you can only advise because you cannot say do not, because that would be an infringement on people's rights. So why we're advising today is so you can make an informed decision. So when next
and help us reduce the burden of the disease. Now that you're aware of it, they say prevention is better than cure. So if you're aware already that your partner have the same genotype with you, your AS, and then your partner is also AS, we humbly suggest that you should rethink and reconsider that. Okay?
Okay. So thank you very much, sir, for that. So what we are going to simply say in conclusion is that sickle cell trait is not an illness.
Yes.
But you should get tested to know if you have sickle cell traits. Because if two people have sickle cell trait and they get married, they can have a sickle cell disease child. Now the other question is, what are the chances? What is the probability that two AS people get married and give birth, and that they will produce a sickle cell disease child.
That's a mathematical probability that every pregnancy there's a probability of 1/4 chance that that particular child from that pregnancy, not subsequent pregnancy, will be a sickle cell child. And then even in the subsequent pregnancy, stand the same chance. The subsequent third pregnancy, it has the same chance.
Exactly. So as you keep getting pregnant, it's not like the probability reduces. It still remains 1 in 4 of every child getting sickle cell disease. So, in conclusion, sickle cell disease is a significant problem in Nigeria. Nigeria is the epicenter of sickle cell disease. We've told you the burden of sickle cell disease in Nigeria, so you can be well informed and understand what people are going through, and also be able to lend a helping hand. Come for screening as soon as you can, and that the burden of reducing it lies on every one of us, both the masses and the government. Efforts must be intentionally targeted if we are to reduce this burden in Nigeria.
And so we call all stakeholders and policymakers and then healthcare providers to bring in all the expertise they have in order to help in curtailing the impact and the burden of this disease in Nigeria, which Limi is well positioned to deliver these services at any point in time. Thank you for joining us online today.
Yes, feel free to send us a DM if you have any questions that you're unable to ask down when you sleep on it. Do follow us on our Instagram page, on our other pages. Like the video, share with others, and join us every Friday by 6 p.m. for more interesting topics and to learn more about medicine from the right source.
Thank you, and God bless you all.
Thank you.